providers in Smoky. Again, we're integrating. We have primary care practices all throughout Western North Carolina because we did a survey, I guess it's been almost 4 years ago now, that indicated we had a significant shortage of primary care providers. So think about it. If I don't see a primary or family practice doc and I'm not being taken care of, I end up all of a sudden in the ED, I'm at the end stage of a massive heart attack because I've never been screened, never been talked about, or cancer, or mental health, whatever the issues are. And so we said having that primary care medical home is the most important thing. That's the hub in that community, trying to bring in primary care providers. So that's what we've been working on, and now we're doing a team-based model. And that's having pharmacy available, behavioral health available, etc. It may be a different model that right now we just did an arrangement in one of our counties that in our practice, someone through the Smoky, one of the providers, they're going to provide someone that'll do an outsourcing to provide that service because they're integrated in that community. Or it may be we do telepsych. We have a psychiatrist or we have social workers available that can do consultation or therapy. So we are right now piloting about 6 different pilots trying to address this because our region is so significant in the barriers to getting the care. So I think that's where, again, understanding each of the communities, where's the hub, where's the network, and how does it work? Because the worst thing for us is to go in and say, oh, we're gonna solve your problem over in Macon County or whatever. Macon County knows Macon County better, just like Buncombe does. And it's us coming together, trying to figure out that network and making it work.
Yeah, I would absolutely agree with everything Sonya said. I think that's one of the things as we are responsible to have a network of providers, if that's individual therapists, large comprehensive providers, and everything in between, is that we absolutely look at each individual county. We actually, people want to know where is the office, exactly what do they do, what are their hours, when are they open, and what is really available to me, and who do they really serve. And the only way we know to do that at Smoky is to have this local presence. I'll go back to a comment I made earlier about our local commitment of that. A lot of that has to do with a group of staff that Smoky has called Care Coordination that have huge caseloads around all 3 disabilities that are their total commitment. It's an administrative function that they are responsible to ensure the coordination of a person's care. So if you get out to Ashe County or you get out to Clay County or Cherokee or Swain or Graham and some of these far-reaching counties, many times it's that care coordination person working with their other community partners. It may be the health department, it may be WNC, if Mission has a hospital there or a primary care physician there, and that there are absolutely, the only way to solve those local rural problems is to sit in the middle of those communities and figure it out. I would love to think before any of us end our career that we will see transportation go away as an issue. I don't know if we will. I want to believe. I believe in hope, and I believe in that. But yeah, it is faith. We're just going to pray that that's going to happen. So I think that when we think about, Smoky's been very committed to have walk-in centers, which does a variety of things for people in local communities. We have a very specific model of 5 comprehensive providers. We put a tremendous amount of relationship in, financial support in, ensure they provide an array of services, most of them for at least 2 of the disabilities, if not 3 of the disabilities. A lot of the people that we're seeing in crisis in these very rural communities are people with intellectual and developmental disabilities, which is a whole nother cadre of services that are needed and a level of expertise that a lot of times in rural Western North Carolina we do not have. And we are very, very sensitive to those individuals and their families. So I think that what we are all trying to do, we're coming in all into the healthcare arena. We're trying to see the whole person completely, as Sonya and we've all talked about today, to really look at that. And I think we have to be very honest. I attend a lot of community meetings. We have staff that go to all the county commissioner meetings. We sit on over 30 to 50 community collaborative meetings in the 23 counties every single month. We have staff so that we stay connected to DSS and what their issues are, the health department, what their issues are. There's hospital representation, there's the sheriff, there's the police department. We have staff, and you may say, why do you have people doing that? We must understand, for the system to get better, what is going on with the community leaders at a local level. And then all those people have to solve the problem. And then they come back to people like us to figure out how else we can additionally either help to incentivize, put resources in. Are we doing enough? So I think that what I would say to you on behalf of all of us is there is a very sincere deep-rooted commitment to the ruralness of how do we do this. I think I feel like I'm still learning how to be an expert in what does rural mental health and IDD care really look like.
And I would say the thing that I have seen the most from reform is the idea of integrated whole health care. It's the idea, I think, that 15 years ago that was not really on the radar. And so I think the thing that we at NAMI would hold up as one of the big changes and the thing that we would honor the most is that we're finally in a situation where all of the team is involved. Because we know that a lot of times the primary care doc is the one who might see the adolescent who's starting to have the beginning symptoms of schizophrenia first, or the beginning bipolar episode. So we are starting to find the idea of this integration, and that's really important because the sooner we intervene with folks, the more we can move people to an idea of functionalized recovery. Because again, mental illness does not go away, it's not curable. But we can get to a place where folks can integrate this into their family and actually know what they're living with so they can own their illness to then be able to create a different life for themselves.